Welcome back to my channel. I'm Will Kang, Orthopedic Surgeon, bringing you another segment of Hot Doctors, in which I ask questions to doctors over increasingly spicy pieces of chocolate. I'm here today with Spiro Antoniades, a very experienced spine surgeon here at St. Agnes. Welcome to my famous show.
Thanks for the invite. Glad to be here.
Great. Well, we're going to start right off the bat. We have these chocolates from Hot Monkey Nuts Company. This first one is just called Hot. So here we go. First chocolate. After you.
Which one? This one? Which one is that?
It's this one. It's that one.
What's this one called?
It's just called Hot. Hot Monkey Nuts. Hot.
Can I smell it?
Sure.
Like my son smells everything. All right, just
So
eat
does
it
my
all.
daughter. Yep. Ready?
Good.
A little bit. What do you think?
I've never had chocolate with hot sauce. I know it's popular.
Well, I understand you're quite the expert on hot foods. In fact, in 2006, you published a book called Hot Sauce Diet, A Journey of Behavior Modification. What's the story of that?
Well, I'm not really an expert on hot foods, but I had to lose weight. I was becoming diabetic, so I created my own system to lose weight using capsaicin. And it was basically behavioral modification where if I would feel, which I felt was an abnormal craving, which I got all the time, I followed that craving with either hot sauce or some type of capsaicin product. And I timed it like that to decrease my eating. And I was losing weight, and my brother didn't believe that that's how I was doing it.
Okay.
So I took a week off work. It was also kind of a project fun, just like you do this. And I wrote a book on it, and I researched it, and I just self-published it. Somehow, someone from the Baltimore Sun heard about it and wrote an article in the Sun, which got picked up by CNN World in D.C. CNN World interviewed me, and when that ran, I sold 3,000 books in 30 minutes. I was number 30 in the world for books. So everybody, it was fun. Everybody thought I'd quit being a doctor, and I failed. I failed though. The Good Morning America called me and said, "We want you to come up tomorrow for an interview in New York." But we had my daughter's 1-year-old birthday, her first birthday. So I said, I have to call my wife because we have 30 people coming over. And they said, okay. So I called my wife. She said, sure. By the time I called back, there was an earthquake in Syria.
Gosh.
And they said, too late. You're off.
That was your big opportunity. You might have met the president or something.
Who knows?
Well, here's a trivia question for you. Which prominent doctor referenced you in a national blog in 2007? Was it A, Anthony Fauci, B, Mandy Cohen, 3, Sanjay Gupta, or 4, Atul Gawande?
Sanjay Gupta.
Sanjay Gupta, yeah. I guess when CNN picked it up. All right, well, that brings us to our second question, which means our second piece of chocolate. Hot Monkey Nuts. They're not a sponsor, but they could be. They called this very hot. And that's this pink one right here.
Okay.
Ready?
Yeah. Very hot. Are you going to know the Scoville units? The Scoville units.
I know what they are, but they didn't report these.
Remember? I don't feel anything.
Me neither. There's a little bit of a toastiness to the tongue.
There's an after, yeah.
Yeah. Well, my second question for you is, what is more difficult, both on a technical level and an emotional level, spine surgery or the euphonium?
Oh. Say one. Which one? The difficult, technical, and then emotional.
Both technically and emotionally, what's more challenging?
I mean, there's similarities to it because I feel, first of all, I'm not good at the euphonium.
Says who?
I'm really good at the accordion. I picked it up in 2014 because my son was a euphonium player, and I felt like it was to start something totally new, work a part of my brain that's never worked before, and I think it's helped me a lot to be a better person. First of all, it's taught me humility. It's also taught me to relax. So, like my teacher would tell me, tight shoulders, tight back, tight legs. It doesn't help you with the euphonium. You've got to relax your entire body and just think of either the tone and your embouchure. And it's helped me relax. So I use the same technique in the OR that when I'm operating, I just think of the nerve root, for example, and the rest of my body should be totally in tune and relaxed. And it helps a lot. Obviously, spine surgery is way harder.
Okay.
But it helps.
Yeah.
It helps.
Well, let's talk about the accordion. So you actually are a more experienced accordion player.
Yeah.
So when did that start, and what was the peak of your accordion career?
I started when I was 10, and I was really good. My teacher was a professional accordionist, and then once I got to be about 14, 15, that was my peak. He was giving me all of his jobs.
Wow.
And I was making money. I mean, that was like, and it was fun. And I was good. I was playing weddings, parties, all sorts of things. And I told my mom, I'm going to be a musician. I'm good at it. I'm doing this. And she was furious. So she secretly went behind me to the teacher, and she said, under no circumstances do you ever give Spiro another job again. Ever. So he didn't say anything because he wanted still to be my teacher. I was his best student. So then after a while I said, hey, his name was Mr. Khan. Mr. Khan, what happened to all the jobs? He goes, no more jobs for you. And then, I don't know, I still had this, that was basically at 14, 15. So, but I still had this drive. So I taught myself piano and accordion. A piano and organ, and I was at the organist at several churches. And then I did that, and for some reason, being in the church was okay for my mom.
Okay.
So I did that for years, but then in college I dropped everything.
Well, I guess it worked. Your mom, her surreptitious strategy of just
Who knows?
platooning your music
She didn't
career
tell me
worked.
for 20 years later. 20 years, I never knew why.
Well, that's incredible. Well,
She said once she was angry at me, she goes, if it wasn't for me, you would have been a musician. I was like, why do you say that? She goes, I told the teacher. I was like, are you serious? I was so angry. I was so angry.
So you could have been Spiro Antoniades, world-renowned accordion player.
Weird Al Yankovic, it'd be something like that.
Yeah, the
probably.
serious Weird Al Yankovic. Well, that's an amazing story. All right, well, we're halfway through. The next one is labeled insane. The next chocolate. That's this dark one. You ready?
Yeah, you're going to take it too?
Yep.
The big one.
This one, right?
Okay. Got a smoky taste.
Yeah. I tell you, the first time I did this, and this time as well, I thought they mislabeled it.
Why?
I think this is less hot than the previous one.
I agree.
Yeah. Well, sorry, Hot Monkey Nuts. Insane. Not that insane. Well, are you into superhero movies at all? Superheroes, comic books?
70s.
If you were a superhero, what would your superpower be?
I do have a superpower.
Yeah.
My superpower is the surgical microscope.
All right.
But I'll play your game. So what would my superpower be if I was a superhero? I mean, can I just be Superman? Or that's cheating.
Sure. I mean.
I do want to be Superman.
All right. Good one.
There's no question. He's like the best superhero.
Yeah, it's almost not fair, you know. I think that's.
He kills everybody.
Yeah, no one could possibly
No.
accomplish that. There was a movie called Batman v Superman.
No, it wasn't even true. It was stupid.
Of course Superman's going to win. What a ridiculous video.
Yeah,
but
stupid.
Funny enough, I kind of thought you were going to say the microscope. So what does a microscope do for you? When you start using the microscope, why is it a superpower?
You can see. So you can see things that you cannot see without it. Sure, you can see somewhat, but you can see. Also, the other benefit of the microscope, surgical microscope, is they've gotten very good. Like before 2003, 2004, they were unwieldy and difficult to use, but the new ones now are very, very easy to use. You can become agile very quickly, and you stand upright the whole time, which is nice, because otherwise you're bent forward like that, and we're like a dentist, which is exhausting.
Yeah.
But with the microscope, you're standing upright, so you can stand like that for hours and hours. So
Yeah.
it really helps.
Is there a surgery you used to do without it that you would never do without it, if you know what I mean?
Is there a surgery that I used to do
Without a microscope.
that I can do now without a microscope?
Right, like now going back.
I do everything with a microscope, everything.
Oh yeah, so in general, there's no advantage to not using a microscope.
I use it for everything.
Okay. Is there a surgery that's not possible without a microscope?
A surgery that's impossible without them. I mean, you can. I mean, the microscopes are new. So they used to do the same surgeries, not as well. So you can be very precise, and you can see a lot better. Also, your assistant sees better. Now, this is controversial. Some people don't use them.
Really?
And they say it's fine. And that's fine, too. But as far as I'm concerned, it could be I'm old, because the older you get, your vision's not as good.
Mm-hmm.
So it helps you magnify everything. That's my opinion.
Yeah. You know, in the I talked to my brother about this. In the general surgery world, there's this went from open surgery to laparoscopic, and everyone said, "Oh, well, that's ridiculous." And now we're going from laparoscopic to robotic, and now people are thinking, well, they're losing the laparoscopic skills in favor of the robot, which seems to be a superior technology. In the orthopedic world, we have arthroscopies, mostly for shoulders and knees, which give us some advantage. But funny enough, rotator cuff repairs are not any better arthroscopically versus the mini open. That's fact.
Yeah, I believe it.
So, all right, well, we're coming on to the last chocolate. On Amazon, they market it as the world's hottest chocolate, and they have a warning that says you should only eat this little tiny piece. So this is the final one. This should be more insane than the insane one.
Okay.
And
Let's do it.
let's give it a try.
It's really small. Oh, definitely hotter.
Definitely a step up.
Have you ever had ghost pepper?
No.
I'm gonna tell you my ghost pepper story,
Oh, let's hear it.
if you don't mind.
No, let's do it.
So my nephew comes over during a Ravens game. He say, "Hey."
Yeah, there's a delay. I'm feeling it too.
Yeah. He goes, "Spiro, I got you some ghost pepper sauce." Ooh, this is really hot. And I didn't hear ghost pepper, just her hot sauce. I said, "Put it in the cabinet." Ooh, this is really hot. So I forgot about it. So I used to routinely do this thing is I would put a ton of hot sauce on eggs.
Mm-hmm.
I would throw out the yolk and fill the egg up with hot sauce. I filled it up with whoa. This is
Yeah,
hot.
I'm feeling. Yeah, it kind of goes like this.
This is like a ghost pepper.
Yeah.
I'm not going to drink anything. So I had a whole egg of ghost pepper sauce. And it's doing this actually right here.
Uh-huh.
You don't feel anything initially. And then you get this like wave, like a tidal wave. It's like wave after wave after wave after wave. And I thought I was going to die, which I feel like right now. So when my wife came home, like I was in the middle of this, I was by myself. I was on all fours in the living room. And she's like, "What is going on?" I was like, "I don't know, but I had hot sauce. I'm dying." It took me 10 minutes. I almost went to the ER. It took me 20 minutes to get back to normal.
It was it.
This is hot pepper sauce. This is ghost pepper.
This is ghost pepper. Probably.
Yeah, it's probably 10.
This one does have a Scoville. It's something like 9 million or something.
Wow, you don't need this, do you?
Do I eat this regularly? No, I've only eaten this for this world famous show.
Oh my God.
I'm with you. If you don't take a drink, I'm not taking a drink.
No, I'm not. It's cheating. The other thing, somebody gave me some ghost pepper sauce, and I put it in a cup of soup
Uh-huh.
at lunch at work. I just put 2 drops, and I coughed for 30 straight minutes.
So the real question is there any pictures of you on all fours reacting to the ghost pepper? No document. I guess this is
My
before
wife
everyone had.
she was so scared. She thought I was having a heart attack.
It's true.
It took me a long time to explain to her that I had hot sauce. And then I thought it was just regular hot sauce. I thought I was having an allergic reaction.
Yeah.
And then when she got the bottle, she's like, Spiro, this is ghost pepper sauce. Did you know it? I was like, no.
Well, yeah, I'm feeling this. I'm sniffing. That's what I feel.
Essay's going downhill now.
Yeah, I think we're over the worst of it.
But imagine this for 20 straight minutes, like a crescendo. For 20 straight minutes, a crescendo.
Well,
And then it went down.
okay, maybe I'll do that.
That was about 5 minutes, wasn't it?
I don't even think that much. 90 seconds, maybe. All right, well, the last question. Now, you are a very experienced spine surgeon, but you've also experienced spine surgery as a
Right.
patient.
Right.
So what has that experience been like?
Well, I've had 3. I had 2 decompressions and finally the big one, a fusion. And it failed. The decompressions failed and finally had a fusion. And it hurt a lot.
Yeah.
And I'm doing very well, actually, extremely well compared to how most people do. But what it taught me is the level of pain, suffering, and disability that people go through. And it most certainly has made me empathetic towards what people feel. So I think it's good. I think it's good to go through things that you do as a physician, and it changes your perspective. So I'm kind of glad I went through it. I feel a little bit, I think it was kind of a little bit like fate for me to go through a spine surgery, and I'm doing very well. So it's been good so far. I had a good surgeon, and everybody was super nice, and I'm glad I did it. And I'm testament to the patients because I say, look, I had the same thing,
Right.
and they know that I've been through it, so I can explain it to them. So they kind of like that too.
Yeah, I'm sure they do. I mean, there's a couple things that you never know what it's like. I always say having a baby, there's no way you can know what that's like. And I bet spine surgery is maybe a step below that. But how do you go about picking your own spine surgeon? I mean, it's one thing to be the spine surgeon for a doctor.
I know, it's hard. So if you think about it, actually I thought about it a lot. Do you want to go to a tertiary care center, which those guys are good. I don't know them personally. Actually, one of mine was a tertiary care center. Do you go to a private practice guy? Do you go to somebody out of town that nobody you know, or do you go to somebody you know? And I basically chose. I mean, my first one was a university guy, and the experience was excellent. But then the second and third was just a friend of mine, my old partner, Charles Edwards. So we've always been friends, and I knew he would take care of me, and he did. And I think I trusted him, and I think that's key, actually. If you can trust the individual, I think that's. And that patients say that to me too. They say, "I trust you," and I think that's the most important thing. I mean, I have patients come from really far away. I mean, they were from Baltimore. They moved away, and then they need another spine thing. They don't care. They drive hours just to see me because they trust me.
Yeah.
And I think in human interactions, it's critical, to be able to trust somebody.
Yeah, absolutely. Do you know, what did he think about operating on you? Did he try to talk you out of it?
No,
he was excited for it?
no. You mean as far as the indications?
No, as far as I'm operating on my friend, I mean, it might
No,
get
he's not
emotionally
like that.
involved.
He's like he was fine with it.
Really?
He's tough. Yeah. Some people don't like it,
Yeah,
and I can see if he would have said no.
yeah,
And I asked him, I was like, "Would you be comfortable?" He's like, "Yeah, I can do it."
right. Like your brother, who also operates here as a total joint surgeon, what if you asked him to do your total
All right.
knee?
All right, I got a story for my brother. You know the story of my brother when he operated on me?
No.
It's not a real surgery. I had an infection. I had a liquidum bursitis that was from MRSA. So my whole arm was red, pus. It was terrible. So my brother said, just go to the St. Agnes ER. I'll take care of you. So he shows up, and I was like, dude, you gotta cut this open. I think there's pus. And he goes, you sure you want somebody else? I was like, no, just take care of it. Just do it. I think it was infections. You can't really anesthetize it,
Right.
So he anesthetized it. It was painful. I was screaming. And then he was cutting it. I was just screaming in the emergency room. I was like one of the patients. And he's like, stop screaming. I was like, it hurts. He goes, I put numbing. It's like the lidocaine's not working. It's like it's inflamed. It's like it's not. It's just he's screaming. And then after he was done, he said, don't you ever ask me to do this again. He was so angry.
What stage of training was he in at the time?
It
Or
was
was
like,
he out?
It was like 3 years after his residency.
Oh, so he was an attending already
Yeah,
at
he
that
was
point.
like, don't you ever ask me to do this again.
So what if you were under anesthesia? You don't think he'd want to do your total hip?
No.
Yeah.
No.
Well, if my brother, I have a twin brother that works here. If he had a rotator cuff tear, I don't think I would be able to do it, honestly.
Yeah, it's a different feel if
Yeah.
you know the person.
Yeah. Well, that's the end of our segment. Here's your opportunity. Either camera, like on Hot Ones, any last words, either advice, your best advice you've been given, best advice you've ever given someone else, or just a shout out for selling more of your books.
No. My book days are over. I mean, advice, what? I don't have any advice. Just be happy, live life. What I tell my kids is try to live your life every day like it may be your last day, because it may be your last day. And if you have every day have meaning, that's what I always say. And then if you live every day, somehow, if you can, a meaningful day, you string those days together, it becomes a meaningful life. So that's my advice to my kids.
That's great. Hopefully we got that, but be good to yourself. Follow me for more videos. Thanks for watching.